Greetings, I'm Dr. Jung Jong-chul. One of the most common complications during sinus lift is sinus membrane perforation. However, even if this occurs, if you respond to it appropriately, in most cases, you'll be able to do bone graft as well as implant placement. In this lecture, I'm going to address the cause of sinus membrane perforation and ways to address it and prevent it. The contents of the day: causes, treatment, prevention, and summary will be addressed. Let's look at the causes first. During surgery, when you do sinus lift, there can be many complications. Today, I'm going to talk about sinus membrane perforation. Sinus membrane perforation can occur when you form lateral window with a burr. Second, it can be done as sinus is lifted, when implant is placed, and although rare, it can also occur when bone graft is done. First, I'm going to talk about how it occurs very frequently when window is formed using burr. Such mistakes are mostly done by beginners, and even in the case of expert with a lot of experience, if the sinus membrane is extremely thin, during lateral window approach, sinus membrane can be perforated. Lateral window approach, it's mostly done using burr. However, if you do not do it properly, perforation can occur. When you do lateral approach using burr, you need to do side motion, lateral motion, and grind the bone consecutively. You need to pay a lot of attention as you do this and as you master this technique. Next, perforation can occur while sinus lift is done. When you use tools to do sinus lift, perforation can occur easily when it is in direct contact with the maxillary sinus membrane. And if you apply a big device, all of a sudden, perforation can also occur. When you do sinus lift, you need to gradually lift the sinus membrane, and the tool should be in contact with the sinus floor, like this. However, if you misuse the device and if the tool directly is in contact with sinus membrane, or if it is done excessively, perforation can occur. Next, perforation can occur during implant placement after sinus is lifted. In this case, first, if drilling is done excessively, perforation can be done directly. Second, it also can be done if insufficient amount of sinus lift have been done. As shown, if sinus membrane is not sufficiently lifted and if you do the drilling, perforation can occur. When you do lateral window approach, you need to make sure that the sinus membrane is lifted sufficiently up to medial. You can do drilling cautiously afterwards. When you do drilling, you need to adjust your strength and you need to pay attention as you do it. However, if you don't do it and if the drill goes in, if it is impacted in the sinus, it can cause direct damage. This is very rare. However, when you do bone window approach and lift the sinus, sometimes too much bone graft can lead to sinus membrane perforation. Or if the bone graft material is too sharp or coarse, sinus membrane perforation during or after surgery can occur. Therefore, you need to avoid putting in too much bone graft. You need to put it the level so that the bone can be formed around the implant. You need to use fine particle bone graft materials if possible. So how can you observe sinus membrane perforation? When you do lateral window approach, you can visually see it. If you can't really see it, you can use the Valsalva maneuver. You can ask the patient to slightly breathe out while holding the nose. If there is perforation in the area of window approach, you can see that air comes out like that. In this case, if the patient blows excessively, the size of the tear can increase. Valsalva maneuver is used to check whether the sinus membrane has been perforated in crestal approach rather than lateral approach. The most common area of sinus membrane perforation is the medial side. If there is perforation in the medial side, it's very difficult to repair it. Let's look at ways to address it. If there's perforation in sinus membrane, depending on the level of tearing, treatment method can vary. If the size of the tear is in between 2 and 5 mm, during surgery you can use a resorbable membrane can be used to repair it very simply and proceed with surgery. If it is over 5 mm, if you have a lot of experience, you can use resorbable membrane and repair and proceed. However, if you're less confident, you'd close out and wait up to 3 months for the sinus membrane to heal completely before making the attempt once again. In the case, if the tear is 2 mm or less. This occurs frequently when burr is used for lateral window approach. In this case, you need to check the area of the tear and extend beyond the tear like this. If necessary, use the burr once again and grind and expand. Check the area of perforation. Around that, lift the sinus membrane and use resorbable membrane to cover the perforated area. In this way, you'll be able to do bone graft or place the implant in a safe and simple manner. When you do lateral window approach, if there's a small tearing like this, you lift the sinus membrane around the area, position the resorbable membrane, and proceed with surgery. That was how I treated this case. Next, there's a case where the tear is about 2 to 5 mm. This is the most frequently experienced case clinically. You'll be able to restore easily using resorbable membrane in most cases. The resorbable membrane should be large so that it can extend beyond the torn area. And it is more favorable to use a stiff resorbable membrane. The resorbable membrane needs to cover an area beyond the torn area. Once tearing is done, around that, you need to pay a lot of attention to lift the sinus membrane. If you don't pay enough attention, the area can increase in size. You need to look at the area where it's torn and lift the sinus membrane with caution. Once it is sufficiently lifted and resorbable membrane is used, you can do bone graft and place the implant if possible. There was tearing on the medial side. Bone grinding was done, extending that area. Membrane was lifted and surgery was proceeded. Successful lateral window approach can be done in this way. If you cannot see the sinus membrane properly around the perforated area, then you need to grind additionally using the burr to check the problematic area properly, lift the sinus membrane, and do bone graft. Position the resorbable membrane and do bone graft. You can repair it fairly safely in this way. The central side, there's a tear. Around that, you lift the sinus membrane, position the resorbable membrane, do bone graft, implant has been placed. Next, this is an altered way to do it more safely. If you cut the sides of the resorbable membrane and position it on the lateral wall of the sinus, and if you do bone graft after that, this is a safer way. There are some dentists who prefer this method. Let me give you an example. In the upper right posterior area, the residual alveolar bone was limited and therefore lateral window approach was taken. You can see that the sinus membrane has been perforated. You can see such perforation at times. You need to grind the bone beyond the area that is torn. Check the problematic area, do sinus lift. If you do lateral cutting of the resorbable membrane, it will be positioned more safely in the lateral wall of the sinus, and membrane can be repaired more safely. As shown, the membrane is positioned, bone graft is done, and implant has been placed at the same time. After surgery and prosthesis delivery, you can see that this is well maintained. Next, I'm going to talk about doing direct suture. This is done extremely rarely. And this is done extremely rarely because if there's perforation, in the case if it is very thin, if you do suture, tearing can exacerbate. When you do suture, this is done when the sinus membrane is very thick and when there is a vertical tear. Other than that, in most cases, if you use resorbable membrane, you'll be able to repair it very easily and place the implant. Next, I'm going to talk about cases where sinus membrane tears over 5 millimeters. If you don't have a lot of experience, I suggest you end the surgery and wait 3 months. Wait for the sinus membrane to repair, and that'll be the best way to go. If you have a lot of experience, you can use a big resorbable membrane to cover the torn area and proceed with surgery. In the case if it is beyond 5 millimeter, fixing the resorbable membrane is very important. At times, you can create a hole like this superior to the problematic area and do fixation using suture or pin. If there is a lot of tearing, even after bone graft, the membrane does not move, therefore you can get good prognosis. If it is between 3 to 5 millimeter, or if it is beyond 5 millimeter, you need to use a large resorbable membrane to cover the torn area. This needs to be done sufficiently. Let me give you an example. In the upper right posterior area, lateral approach was taken because the residual bone was limited. Sinus membrane was perforated. The membrane was very thin. In the end, in order to lift the sinus membrane beyond the torn area, window was formed. In order to get visibility, you need to form a large window beyond the problematic area. You need to check the problematic site, sufficiently do sinus lift, and use resorbable membrane to repair and place the implant after bone graft. This is post-op image. This is after final prosthesis delivery. This is another case. In the upper left posterior area, implants needed to be placed. It needed to be placed in number 26. There's very limited residual alveolar bone, and you can see the lateral wall is quite thin. Lateral window approach was used very cautiously. However, you can see that there's a lot of membrane perforation. If the membrane is thin, tearing can occur. You need to make a decision as to whether you're going to proceed or wait. You need to choose if you're going to wait 3 to 5 months and then proceed. I decided to proceed with bone graft. Sufficient sinus lift was done, resorbable membrane was positioned, and then bone graft was done. 5 months later, I placed the implant. If there's large perforation, rather than doing bone graft and implant placement at the same time, it is better to do bone graft and wait. Wait for more than 5 months and place the implant in secondary surgery. I think that is the safer way. This is post-op image. You can see the bone graft here. The patient did not return for a long period. Surgery was done in 2012 and the patient came back in 2017. If you look at the image taken during the visit, you can see that the bone graft is well maintained. This is when the treatment was complete after final prosthesis delivery. How can we reduce the possibility of sinus membrane perforation? First, when you form a bony window in the lateral wall, it is better to form it in the ovoid form. If you make it rectangular or angled, there's a higher possibility of sinus membrane perforation and sinus lift can become more difficult. The bony window should be ovoid or circular. When you apply the device, you need to pay a lot of attention as well as touch the sinus floor. Next, if you're going to place the implant at the same time, you need to pay a lot of attention in drilling so that sinus membrane is not perforated. When you do lateral window approach, the window should be formed more mesially. This is to prevent membrane perforation on the mesial side. In the posterior side, there's comparatively less possibility of membrane perforation. When you do lateral window approach, the window should be approximately 3 to 3.5 millimeter from the sinus floor so that bone graft can be well maintained. When you use a device, you need to touch the bone of the sinus floor and do it gradually instead of doing it excessively. You need to pay a lot of attention to it. That's the way to avoid sinus membrane perforation when you do sinus lift. When you do drilling, you need to pay attention to the tactile sensation of sinus floor being penetrated. If you do not do sinus lift sufficiently when you do drilling, sinus membrane can be perforated. Sinus lift should be done sufficiently up to the medial side. You need to drill cautiously and be aware of the feeling of sinus floor being penetrated to avoid sinus membrane perforation. At times, when you use device, You can protect the sinus membrane as you do drilling, however, this can be cumbersome. In the case there's septum, more tearing can occur. You need to diagnose ahead. In the case there is septum, you need to bear in mind and prepare yourself for that. Sinus lift should be performed in a manner as to protect it. You can see that if there's septum, tearing can occur around the septum. So devices should be used with caution. In the case there's septum, during surgery, sinus membrane can be perforated very frequently. Even when there's septum, when the membrane is perforated, you can use a resorbable membrane or you can do suture directly. In the case there's multiple septa, if there's one septum, it's comparatively simple. However, as shown in the upper left, if there's multiple septa, no matter how careful you are, membrane can be perforated. In this case, you need to separate the window and do the sinus lift very carefully. Although I did that, sinus membrane was perforated. As you do with one window, sinus lift was done, resorbable membrane was positioned, bone graft was done. This is post-op image. Secondary surgery was done to place the implants, and you can see that good results have been achieved. You can see that it is well maintained after final prosthesis delivery. The most tricky thing with lateral window approach is sinus membrane perforation. Ways to prevent sinus membrane perforation: you need to make accurate diagnosis before surgery. When you do the sinus lift, careful use of the device is very important. At times, no matter how careful you are, sinus membrane can be perforated. In those cases, if you know how to use the resorbable membrane, you can use that in times of sinus membrane perforation. If you know these techniques, you can do lateral window approach safely and successfully. In this lecture, I talked about the cause, treatment, and prevention methods for sinus membrane perforation. In most cases, membrane perforation can be addressed with appropriate treatment. Depending on the size of the tear and the condition, treatment method can vary. Therefore, you need to know the various techniques to address the problem in order to provide a successful treatment. I'll see you next time. Thank you for watching.